Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How much caffeine is in Excedrin Migraine? Each tablet of Excedrin Migraine contains 65 milligrams, mg, of caffeine, 250 milligrams of acetaminophen, and 250 milligrams of aspirin. A regular adult dose, 2 tablets, contains 130 milligrams of caffeine, roughly equal to an 8 to 12 ounce cup of coffee. How to take Excedrin Migraine. The regular dosage for adults is 2 tablets with a glass of water. Do not take more than 2 tablets in any 24-hour period, unless directed by a doctor. If symptoms worsen or persist, contact your doctor. If you are under 18 years of age, ask a doctor before use. Excedrin Migraine is an over-the-counter, OTC, medicine approved by the FDA for the relief of migraine pain. In clinical studies, patients with moderate to severe migraines experienced relief with 1 dose. It can work as quickly as 30 minutes in some people. The recommended dose of Excedrin Migraine, 2 tablets, contains 130 milligrams of caffeine, which is roughly as much caffeine as found in an 8-ounce cup of coffee. Limit your use of caffeine-containing medications, foods, or beverages while using Excedrin Migraine. Excessive caffeine can cause nervousness, irritability, sleeplessness, and rapid heartbeat. Caffeine has been shown to increase the effects of pain relievers like aspirin and acetaminophen and help to make these medicines more effective in migraine. For some patients, caffeine can trigger a migraine headache, but it has also been shown to be helpful when combined with acetaminophen and aspirin. How well does Excedrin Migraine work? In 3 double-blind, randomized, and placebo-controlled studies with 1,220 participants, researchers assessed the effectiveness of the OTC combination of acetaminophen, aspirin, and caffeine in alleviating moderate to severe migraine headache pain. Participants took 2 tablets of the OTC acetaminophen, aspirin, and caffeine or a placebo as a one-time dose for treatment of 1 migraine attack. Results showed a significantly greater reduction in migraine pain intensity 1 to 6 hours after the OTC acetaminophen, aspirin, and caffeine dose than placebo in all 3 studies. Pain was reduced to mild or none 2 hours after the dose in over 59% of those taking acetaminophen, aspirin, and caffeine compared to about 33% of placebo-treated patients. At 6 hours after the dose, 79% receiving acetaminophen, aspirin, and caffeine had pain reduced to mild or none versus 52% in the placebo group, and 51% of the drug-treated patients were pain-free, with 24% pain-free in the placebo group. Symptoms of nausea, photophobia, light sensitivity with pain, phonophobia, sound sensitivity with pain, and functional disability were improved 2 to 6 hours after treatment. Excedrin migraine is associated with warnings and side effects, some of which may be severe. These include Reyes syndrome, risk of allergy, liver toxicity, stomach bleeding, headache rebound due to medication overuse, caffeine overuse. Review side effects and warnings here. In more detail, related questions: Does caffeine affect Vrela, cariprazine? How long do caffeine withdrawal headaches last? Does Maxalt have caffeine in it? Bottom line. Each tablet of Excedrin Migraine contains 65 milligrams, mg, of caffeine, 250 milligrams of acetaminophen, and 250 milligrams of aspirin. The dosage for adults is 2 tablets with a glass of water. Do not take more than 2 tablets or gel tabs in any 24-hour period, unless directed by a doctor. People under 18 years of age should ask a doctor before use. This is not all the information you need to know about Excedrin Migraine for safe and effective use. Review the full Excedrin Migraine information here, and discuss this information and any questions you have with your doctor or other healthcare provider. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.